Hi there. I wanted to start off today's video by talking about, I guess, a journey that I'm going on right now with a new drug called Wegovy. Maybe not so new. Ozempic, Wegovy, same drug. If you've been watching any of my videos, you probably realize that weight is an issue, and it always has been. Or at least it has been pretty much my adult life. Not so much when I was a kid, but as soon as I got to adulthood, I just I went up and down the weight journey as much or more than anybody I know. I mean, I'm constantly, I'm either in really good shape or I'm in really bad shape, or somewhere in between on the way too. But later adult life has been mostly really bad shape. Don't eat the things I should eat a lot of times, and don't do the exercise like I should, and I get in sort of a mode of let's do the same thing all the time, and that same thing is never really good. So anyway, a few years ago, I lost it all. I got down to like 185, and I really, held it there for a couple years. I was doing really well, but for whatever reason, fell off the wagon, whatever you want to say, and went back up and got as high as 263, which wasn't my highest, but it was, it's getting there. It's definitely way more than I should weigh. Needless to say, I went to my doctor and I said, "Hey, doc, let's get this under control again. I'm ready to get it under control again." And he recommended just to try the Wegovy because other people were having some success with it, and so I decided, go ahead and try that. And I know there's some side effects that people are talking about a lot. They're listed, they're known side effects, different things. I don't want to talk about those. I mean, you might brush on them a little bit, but the known side effects that I've experienced haven't been bad. They haven't been anything that would make me want to stop taking the drug. I have lost about, 20 pounds or so, maybe a little more. I guess it's a little more. I'm down to like 239 right now, which is nowhere near where I want to be, but it's, I'm 5'8", I'm a short guy. I should probably not weigh even 185, but I'm pretty comfortable at anything under 200. I'm pretty comfortable. I'm getting older, but I still have a little muscle mass on me, so anything under 200 is, acceptable. I look and feel fine. Actually, I feel great under 200. So if I could get back there, I'd be very happy. But today, what I want to talk about more than the journey of being on the Wegovy, because there's so many videos out there, and people will tell you, you can watch weight loss videos and how to do it. It's no mystery. If you eat better and you exercise, you'll lose weight. I mean, there's really no mystery to it. Wegovy helps. It helps you not eat as much in various ways. All the other videos can tell you how that works. What I really want to talk about is the one side effect that I've experienced that nobody else is really talking about. And I don't know if I should even really call it a side effect, because I'm not 100% sure that it's related to the drug, although I am 100% sure that it started when I started taking the drug. And as I've kind of delved into where all this side effect could come from, I kind of did a lot of research, and it was hard to find anything on this side effect. And what I'm talking about, just so I don't drag on, if you're not experiencing this, you may not want to watch this video. And you probably don't want to watch it anyway, because it's not really high quality video. I don't do that. I do random stuff. So if you like it, you like it. If you don't, you don't. I'm sorry. It's not Sundance Film Festival. It's YouTube. Sorry. But the side effect that I'm experiencing and that I have experienced a lot is basically skin sensitivity. I've noticed since I started taking the drug, and you go through the lower dosages right on up to the full dose of the 2.4, my skin is overly sensitive. Like when I do this right now, I can feel it, and it's not a good feeling. It's not a normal feeling. Now, is it pain? Well, yeah, on a low scale. It's not like this. I'm not going to tell you that my skin is on fire or it's a 10 out of 10 on a pain scale, but it's enough to be annoying, and it's enough to where, for instance, when I put on a shirt and I walk around, I can feel the shirt. I can feel it on my back. I can feel it on my arms as I move or turn. I can feel the skin, and it's very sensitive. As I lay down in bed at night, I can feel the sheets on my back, and it's very, very sensitive. The longer I seem to go during the week, like when I take the drug, it amps up a little bit. And then, towards the end of the week, before you take the next injection, it gets a little bit better. So today is the 7th day. I'm due to take another injection. It's not as bad today as it was yesterday and the day before. It probably peaks at about the 4th day in, which leads me to believe that it's related somehow to the drug, but it's not a listed, that I can tell, and I've read everything. I don't see anything as it being a listed side effect. I don't know what it means. I don't really think it's that big of a deal, but I just wanted to make this video, put this out there, because look, when this started happening to me, I went back to the doctor and I basically said, hey doc, test me for Lyme disease, test me for, do the blood work, see what's going on here, because I'm having these symptoms that are really strange. I don't know where they're coming from. And I didn't put it together at that time with the drug. Part of that was because at the time I went back and had him test me, I was on lower dosages, and it wasn't as bad. It was starting to be annoying. It was being annoying enough to where I contacted the doctor. But it wasn't annoying to the point where, I really just couldn't take it. And it still isn't to the point where I can't take it. But it is to the point where I'm starting to think, okay, is it something I want to deal with to take this drug? Or maybe is this a drug that I need to just stop taking and just lose the weight the old-fashioned way? Which I still am. You're still losing the weight the old-fashioned way. The drug is just making it a little simpler to do. It makes it a little easier to turn your nose up at the plate of food in front of you. And that's really what I've experienced. It's not, people will tell you it's a miracle drug. It's not really. It's a good drug. It's, from what I can tell, as far as it does make you want to eat less. But for me, I'm starting to have some hesitation, and it's from the skin sensitivity. So listen, I don't want to dwell on it. It's just something that I haven't seen any other videos on out there, and I think that I wanted to kind of get some feedback from other people that may have experienced this. Another reason why, I kind of put it with the drug is in my research and trying to figure out what was going on after I got tested and everything came back negative. I got tested for Lyme disease and autoimmune stuff, and he basically ran my blood and said, we're going to test you for all the bad stuff and rule that out, and it was all ruled out, right? So, here I am. I'm still having the symptoms. They're getting a little worse as far as the skin sensitivity. It's getting a little more sensitive, and it was getting a little worse. So I started doing my own research. I started getting on the internet and just pulling stuff, figuring out where this is coming from. And there's so many things that it could come from, and none of them were anything I was experiencing. Like some of it was anxieties, was a cause, maybe overuse of non-steroidal anti-inflammatory drugs. That was another thing that, you know, could cause it, I guess. And when I heard that one, I immediately stopped taking, you know, all the other NSAIDs, you know, the Tylenols, the Advil. Stopped taking those for weeks just to, you know, see if that was causing it. It didn't help a bit. In fact, taking those kind of helps a little bit, but it doesn't help a lot with the skin sensitivity. But it does help some. Just my dog, don't mind him. He's a good boy. He just kind of likes to be around me all the time, like 100% of the time, all the time, right? It's great, actually. I love it. But so anyway, I want to get some feedback. If anybody else is experiencing that, let me know. In my research, I went online. The only thing I could find, the only written thing out there I could find was a Reddit, you know, post or something. Some people on Reddit, you know, great source for information, right? Now, who knows? But some people on Reddit had wrote about this, and it kind of made me think, okay, well, I'm not the only one, apparently. There's somebody else out there that's having this effect who's on the drug. Again, I'm not saying it's even a side effect of the drug. What I'm saying is that I'm on the drug and I'm experiencing it. And other people who are on the drug are also experiencing it, according to Reddit. Not 100% sure that it's related, but I think it's odd, and it's probably something that you know, needs a little more research. Maybe there's more people out there who you know, are on the drug and experiencing this and just kind of lost as to where it's coming from. You know, maybe they're not equating it to the drug, and this will help them. Hopefully, you know, you won't think you're going crazy if you hear somebody else saying they're on the drug and they're experiencing this too. Because after, you know, this is kind of a weird symptom, and when you go to your doctor and have them test you for Lyme disease, you know, luckily my doctor knows me and didn't think I was crazy, but, you know, and I am playing with dogs all the time, and so maybe he thought I had a tick bite or something. I thought I actually had a tick or a spider bite or something, you know, months ago, and figured maybe I could have Lyme disease. But anyway, if you're experiencing it and you want to throw me a comment or something just so that I, you know, hopefully help somebody or realize that this is where it could be coming from. I don't know. You know, not looking to get sued by a drug company. You know, like I said, I'm still on the drug. I'm still taking it as of right now. I don't know that I will be long term or not. It kind of depends on if this gets worse. If this gets worse than it is right now, I'll probably stop taking it, to be honest with you. But if it continues to be the same level or even a little bit less, then it would be something I could probably live with. At least short term while I lose the weight, and then, you know, maybe try to wean myself off of it later. Yeah, so anyway, that's it. That's my spiel about the skin sensitivity. If you have any questions about what I've been experiencing, you know, you can always message me or put them in the comments or whatever. I'd love to hear your experience, if you're experiencing this or not. I don't need, you know, I've lost 50 pounds or whatever, because everybody who's taking this drug is losing weight. It's very effective at making you not want to eat as much. There are other drugs that are also as effective, or effective anyway. I don't know if they're as effective. Maybe they're more effective. I don't know. I've lost weight without this drug before. Plenty of, actually, you know, few times. The problem is I was fine the weight, right? You know, losing it's not a problem. The problem is I was find it afterwards somewhere, you know, in a couple of years. Here we go again, right? So that's most people's problem when they lose weight, is not that they can't lose it, it's that they can't keep it off, or at least long term. But that's not what this is. It's not a weight loss video. It's not a, you know, I started Wegovy and I'm going to be here every week telling you exactly how much weight I've lost video. it's really not what I do. I kind of do random stuff with dogs and, Halloween props and cooking and just whatever happens to, strike me as something somebody might want to partake in or watch on any particular given day. I don't even make that many videos, guys. So, I'd ask you to subscribe so I could monetize one day, but really, I'm not going to make that many videos. I'm going to make like 1 or 2 videos as things arise, and I think that there could be a need for a video or, have a desire to make one. It's just not that often. So, subscribe if you want to. It'd be great, but if you don't, believe me, I understand. I've got 1 million subscriptions to different stuff on here too, and most of it I never watch. So anyway, thanks. Comment if you're interested in this particular topic, and I'll be glad to go back and forth with you a little bit and tell you my experience in a little more detail if you need me to. But have a great day. Thanks.